Greetings. We welcome you to this webinar, Impact of Federal, Faith, and Community Partnerships during COVID-19 Vaccination Distribution. My name is Nicole Wood, and today I will serve as your moderator. July is Partnership Month within the U.S. Department of Homeland Security Federal Emergency Management Agency. Today, to commemorate the month, the DHS Center for Faith-Based and Neighborhood Partnerships and the White House Office for Faith-Based and Neighborhood Partnerships are hosting this webinar to highlight federal, faith, and community partners during the COVID-19 vaccine distribution. Responding to the global COVID-19 pandemic has required a whole of community approach. From the front lines of medical providers, first responders, and emergency managers, to faith and community leaders, and hundreds of thousands of volunteers, to our educational institutions, the private sector, and federal agencies, many of which have tirelessly committed their time and expertise by working to sustain life as best we can through the COVID-19 vaccinations, and to honor those we have lost through our funeral assistance program for those who are eligible. As people living and serving in communities nationwide, not just are we socially connected, we accomplish more when we engage in partnership. Leveraging our partnerships in multiple sectors in response to COVID-19 has increased our collective impact in our country, for our humanity, and for the betterment of our world. Today, we have an opportunity to briefly pause and learn from our guest speakers who have served in unique partnerships across our nation and world in support of countless lives, many of which they may never know, even the magnitude of their impact, but yet maintained focused on sustaining lives from the COVID-19 virus. With that, let us begin. Next slide. During our webinar, we will hear from Melissa Rogers with the White House Office of Faith-Based and Neighborhood Partnerships. We will hear from Dr. Hannah Vick. She's with the Federal Emergency Management Agency. Sarah Deitch, who's with the U.S. Peace Corps. Ms. Corinda Washington with the U.S. Department of Homeland Security's Office of Partnership Engagement. And Dr. Golda Downer, who's with Howard University. And today, she is representing herself as one of the co-chairs of the Historically Black Colleges and Universities COVID Awareness and Resilience Day. Finally, we will have question and answer session with all speakers at the end of the presentation. Next slide. First, please allow me to introduce Ms. Melissa Rogers. She's the Executive Director of the White House Office of Faith-Based and Neighborhood Partnerships and the Senior Director for Faith and Public Policy within the Domestic Policy Council. Previously, Melissa Rogers served in the Obama administration as well as the visiting professor at Vick University School of Divinity, as Executive Director of the Pew Forum on Religious and Public Life, as the General Counsel of the Baptist Joint Committee on Public Affairs, and as a non-resident senior fellow at the Brookings Institute. I am grateful that our office has the privilege to serve under the leadership of Melissa Rogers as she has joined us today to provide opening remarks. Please welcome Melissa Rogers. Thank you.
Thanks so much, Nicole, for that really warm welcome and for all your work at DHS. It's great to be with you all today. And hello, everybody. Thank you for joining us for this important presentation and conversation this afternoon. We are so grateful for the work that you have been doing to try to help our nation heal, both literally and figuratively, from this COVID-19 virus. So thank you so much. This is going to be a great conversation and help us to do more good in all of our communities. We're so thankful for your partnership. As many of you know, President Biden reestablished the White House Office of Faith-Based and Neighborhood Partnerships earlier this year. And President Biden, all through his career, has been closely connected to faith and community leaders and really understands the difference that partnerships with faith and community leaders makes. So he was very clear about this from the beginning, that we were going to reestablish this office and we were going to tackle a wealth of problems, starting with the COVID-19 pandemic. And so that's continuing to be a focal point for us as we try to increase vaccinations, and we simply could not do that work without you. In addition to the White House Office of Faith-Based and Neighborhood Partnerships, we have centers for faith-based and neighborhood partnerships spread across a number of federal agencies, including the Department of Homeland Security, and a corresponding presence in FEMA. And so this is just a wonderful network that we can use to convene partners and potential partners and share information. Partnerships are always a two-way street. So while we're imparting information, we learn as much from you as you do from us about how these partnerships need to be structured to be efficacious. So this is a wonderful system that has been in place for more than 20 years, and we're just looking forward to bringing it forward into the challenges that we face today and in the future. Well, as President Biden said yesterday, there have been over 300 million COVID vaccination shots to date, with 60% of adults fully vaccinated and nearly 70% started on vaccinations. Cases are down, deaths are down dramatically, and for that, we really give thanks and rejoice. One estimate suggests that our rapid deployment of the vaccine has saved 100,000 American lives, perhaps more. And again, that's cause for celebration. Yesterday's announcement by the CDC that new research and concerns about the Delta variant lead CDC to recommend a return to masking in parts of the country is another step on our journey to defeat this virus. Yesterday's announcement also makes clear that the most important protection we have against the Delta variant is to get vaccinated. Although most U.S. adults are vaccinated, too many still are not. And while we have seen an increase in vaccinations in recent days, there is still room to improve. We need to do better in getting more people vaccinated. And of course, as you all know, vaccinations are free, they're safe, and they're effective for Americans. We've been able to make sure that every adult in this country for more than 3 months can access a vaccine at a location 5 miles within 90% of the U.S. population. And so by following the science and doing our part to get people vaccinated and encouraging others to get vaccinated, we will beat COVID. Partnerships with faith and community leaders have always been central to this effort, from the first day that President Biden took office and continuing to today. So again, let me thank you so much for what you're doing. You help us understand how we need to reach people and communities. Your voices are so respected and your work is so valued. We are charging, ahead and trying to fulfill the responsibility that we have to work with people of all beliefs and backgrounds to get this job done. We can really work together to help people heal and unite and rebuild. So today, we're really fortunate to have this wonderful group of leaders to talk to us. Not only do we have Nicole Wood, we have Brandy Richard Thompson, and Corinda Washington and Dr. Vick. We also have Sarah Deach and Dr. Downer, who will offer really valuable perspectives and insight based on their experiences working in this area. And I just really want to thank the panelists for all the wisdom that they have brought to this task and for all the help that they're giving us now and into the future. So you're going to hear from them about the partnerships that we've already established and how those have worked, and the work ahead, how we need to keep building on what we've done and strengthening these partnerships. This conversation is even more important today because these same partnerships are absolutely crucial to ensuring that we are able to battle against COVID-19 and win this battle. So with that, let me just thank everyone again for your participation, your care and concern about your fellow Americans and people around the world, the way that you take time from your busy schedules to really serve people in need in your community. It's something that makes our country great, and we are just so thankful for your efforts. So thank you for your work. Together, we can beat this virus, and we look forward to doing so in partnership with you. So with that, let me just send a round of thanks again and turn it back over to Nicole.
Well, thank you so much, Melissa. We truly appreciate you providing those opening remarks, for the kind words you shared, and just uplifting the importance of us time together, really the time of healing, to unite and to rebuild. And we certainly want to keep that as our focus collectively, as we all have been working tirelessly on this effort, and in particular as we're working collectively in partnership. So again, thank you for your kind words. Thank you for your time, and certainly grateful to have you today.
Thank you, Nicole. Great to be with you all.
Excellent, excellent. With that, we're going to go ahead and now begin hearing from our panelists. We will first like to introduce, and starting with our next slide, hearing from Dr. Hannah Vick. She's the Senior Advisor for the Office of External Affairs, Federal Emergency Management Agency within the U.S. Department of Homeland Security. For more than 15 years, Hannah has led external affairs teams during response and recovery field operations for FEMA, specializing in public information and external stakeholder outreach. Hannah's disaster management expertise includes more than 70 field deployments related to national security events and national level exercises. She has led communication outreach teams during Hurricane Sandy, during the Flint, Michigan water crisis, the Ebola virus disease, and now the COVID-19 response. In addition, Hannah serves as an adjunct lecturer at the Georgetown, Washington's Masters of Emergency and Disaster Management program at the School of Continuing Studies. And in the meantime, while she's doing all that she has earned her Ph.D. in 2020 while leading the efforts in the COVID-19 pandemic response. With that, we're going to turn our time and attention over to Dr. Hannah Vick. Thank you so much for joining us today, Hannah.
Very good. And thank you so much, Nicole, for that introduction. And big thanks to Melissa Rogers and Nicole Wood and Brandy Richard Thompson for all of their leadership in bringing this together. I know I always learn so much from these types of events, and it was an honor to be asked to participate. And I was especially pleased to be invited because I know firsthand how important it is with the faith-based community is to disaster resilience. So I was raised in a very small town in Wisconsin, rural Wisconsin, where my father was a reverend at a very small church. And one of my very earliest memories, I must have been about 4 or 5, was of a terrible snowstorm that shut down the nearby interstate. And the police chief asked my father and the pastor of a church nearby to take in some of the stranded motorists. And I vividly remember this makeshift shelter that we put together in my dad's church. And I remember the ladies in the kitchen, and I remember my dad carrying this big stack of blankets. And I remember the families who were grouped together there in the church as they waited out the storm. And it's such a powerful memory, and it's very much a powerful reminder that I've kept with me in my 15 years with FEMA. It's a reminder that disaster relief, no matter who gives it, is extremely personal. It's person to person. And the most meaningful and impactful assistance is done with compassion and with connection. So like Natalie alluded to, this spring, I led our external affairs effort for the COVID vaccination mission, which included engagement of a variety of community-based organizations. And in this presentation, I'd like to give you an overview, just a quick overview of FEMA's role in the mission, some of our outreach, and then our lessons learned. So next slide, please. So very quick overview, just at the top, of FEMA's role in the COVID mission, which began early last year. And I know it began early last year for all of you as well, but FEMA's role in any disaster is to coordinate resources and primarily fund local, state, tribal, and territorial response and recovery activities. For the COVID mission last year, we were called upon to work with our partners at HHS, CDC, and DoD to find and deliver critical supplies, including medical equipment and generators. Building out and resourcing these alternate care sites would have looked like a field hospital. And then also providing a funding stream for the extraordinary efforts of our partners at all levels of government. So, next slide. Almost as soon as President Biden was sworn in, he issued an executive order directing FEMA to work with the National Guard to energize and really jumpstart the vaccination effort across the country. And FEMA's role in this was really supporting our partners with money, with personnel, with material, and with equipment. We supported thousands of community vaccination centers across the country, those centers that were run by state and local communities. And our most visible effort was standing up federally run community vaccination centers, which could vaccinate upwards of 6,000 people a day. It was those mass sites that you probably saw on the news. So over the course of 4 months, we, and along with our partners, stood up 38 mass vaccination centers, which administered more than 5.6 million doses. None of that would have been possible without the grassroots efforts of community organizations on the ground. Those organizations went door to door. They helped their neighbors to make appointments and to register. They took their neighbors to the center. They got the word out about the importance of vaccination. And FEMA and DoD might have set up those sites, but the community on the ground actually made them successful. Next slide. COVID-19, I know we all know this, but COVID-19 was such a stark reminder that disasters disproportionately affect underserved communities. And during the COVID vaccine mission, FEMA, we really oriented our community vaccination centers toward advancing equity. So we did this two ways. So the first is that we strategically located the centers in underserved areas. And then the other way is that we tailored our messaging for those particular populations. So all of this was done through data-driven decision-making. When we strategically located those CVCs, we used the SOVI index, the Social Vulnerability Index, and we wanted these centers located in places that had a high SOVI index ranking. And actually, we refused to put the community vaccination centers in locations that did not or would not serve underserved populations. So in that way, we also prioritized accessibility. So we know that there's any number of barriers out there for individuals getting vaccinations, including transportation issues, access and functional needs, thinking about just time and daycare and work, all of those things. We wanted to make it so that it was as easy as possible for individuals to get vaccinated if they wanted to. And as a result, more than 58% of all doses administered at the federal pilot sites went to communities of color. So the lesson that the agency really learned out of this was that advancing equity means intentional decision making. It means planning for the future with a deliberate focus of turning equity ideas into action. And that takes it again and again and again. It's not just a one-time thing. So FEMA as a whole is very much looking at ways in which we can reevaluate our programs to advance equity before, during, and after disasters. Next slide. And one more for time. So talking about partnership and outreach. So during the community vaccination mission, we employed a number of different techniques for outreach, right, and for partnership. So FEMA has 10 regional offices that work directly with states, tribes, and territories. We have them with very strong partnerships with HHS and CDC. And what we did is we pushed staff down to the ground level at the community vaccination centers to be there and work one-on-one with the different organizations that were promoting and supporting the effort on the ground. The most important thing, though, when we were doing this is we wanted to make sure that our team recognized that the organizations that they were meeting on the ground had been working COVID since day one. Like, they knew what needed to be done. They knew their communities. They knew how to make an impact. And our role at FEMA was to support them and to facilitate that message delivery. So there were two key takeaways that I'd say that we learned from this mission. There were many, but two key ones. So the number one takeaway was understanding that the audience has never been more important. So Of course, we here in July, we're in a vastly different place with vaccination than we were in February, when demand really outstrips supply. So right now we're facing new challenges. But even back in February, we knew that people were hesitant to get the vaccine for a variety of different reasons. And it was really, really important that we understood what those reasons were, because you had to tailor your message to that reason. You couldn't provide a message that wasn't quite right for a certain population and expect that message to resonate or to influence behavior. So what we did is we had to rely on the community-based organizations to find out what the message needs were on the ground. And because we couldn't make that decision or determination at headquarters, no matter how much data we had, right? We couldn't make it at the regional offices. So we had to rely on the information that was coming up from the ground. And a big example of this was the community-based organizations in many locations were absolutely critical to the success of our mobile vaccination units. So the CBOs were there. We relied on them to tell us where to go. We relied on them to help us make appointments with individuals that perhaps were underserved or had accessibility issues, get the word out in the neighborhood, and then organize transportation. So, CBOs were front and center in understanding the needs of the community, and our role again at FEMA was to listen and to absorb and to support in whatever ways that we could. The second key takeaway, I would say, is really this focus on amplification through ambassadors. So we knew very early on that FEMA is not the best messenger for any vaccination message. We don't have the same credibility as public health, and we don't have that personal connection, right? So our overarching strategy really across the federal government has been to facilitate this message delivery through the ambassadors that do have those connections. Formal agreements and informal agreements. So the CDC, HHS, and White House all have formal agreements with a number of different ambassadors, like celebrities and faith leaders and big nonprofits and corporations, all of those agreeing to take back those vaccination messages to their stakeholders. So along those lines, what that meant is that when we were thinking about the resources that we needed to provide, we thought of toolkits. How can we facilitate this message delivery through our ambassadors? And for example, the CDC has this amazing suite of toolkits that are targeted for particular populations. And the whole intention is that they can be used by ambassadors who are familiar with their local community, and then they can take that and modify it in the best way for their particular audience. The real impact, like we all know, is going to come from leaders, and this is the reality moving forward, right? That it's the people that are on the ground and in the neighborhoods, at the grocery stores, and at the pulpit. Those are the ones that are going to make the difference in terms of moving us toward a more vaccinated population. Next slide. So in wrapping up, thinking about where is it that we go from here. So vaccination mission is still ongoing, especially with Delta, but FEMA, we're preparing for the hurricane season, and we've already got wildfires out west. So for external affairs here at FEMA, we're looking to take the lessons that we learned from the CBC mission and integrating them into our regular disaster operations. So for example, we're really trying to open up the aperture of what it is that we consider a partnership, a community-based organization that we would partner with. For those of you that are familiar, oftentimes FEMA and other emergency managers will focus on what we call voluntary organizations after disasters, or the VOADs. Wonderful, wonderful group of people, but we do know that there are other organizations that don't belong to that group that offer social services and other elements of the community. So we in External Affairs are looking at an ambassador program that would formalize some of these agreements or formalize some of the message sharing with a full range of community-based organizations. So lots and lots to be done, but I can tell you that the focus on equity and the CBC mission has really energized our agency, and we're looking and focused on reducing barriers and increasing access in every way possible. So next slide. So in closing, thanks again for the opportunity to speak today. A couple of email addresses here in case you'd like to reach out to FEMA, and appreciate all the work that you do to make lives better all across the country. So thank you.
And thank you so much, Hannah. We truly appreciate what you've shared, and certainly acknowledging the fact that as government, we're not the experts. That is in partnership with our community and faith-based partners who are on the ground, who are able to share what are the needs of those who haven't been served, and how do we partner along them in being ambassadors. I think to me were some incredible key messages I heard from you, recognizing that as government, when we're partnering on the local level, how we rely and certainly want to come alongside faith and community groups in serving the public. So again, we thank you so much for your time and all that you've shared. Now let us shift to hear from our next presenter, who is with the U.S. Peace Corps. What is exciting to share is that this is the second time in the history that FEMA and Peace Corps have partnered together in response to the COVID-19 vaccination. So we are certainly excited to have our next presenter speak with us. And so let me please welcome Ms. Sarah Deach. She is the new Director of Peace Corps Response. She brings more than 20 years of public sector experience, including work on election management, Homeland and aviation security, and rural development. In her former role, Sarah served in the country of Georgia with the United States Department of Agriculture, managed and implemented the Department of Homeland Security's engagement with members of Congress. She also served as the Chief of Staff in the Office of Legislative Affairs at DHS and within the Transportation Security Administration. Sarah also held positions with the United Nations to build capacity in international election management, where she developed and implemented voter education campaigns in Liberia and Cambodia. In addition, Sarah began her federal career while serving with the former Senator Tom Harkin. With that, I'm excited and glad to present to you all Ms. Sarah Deach. Welcome.
Thank you, Nicole. Thanks very much for the introduction and for the opportunity to be a part of this panel. It is always wonderful for me to return to the DHS family. So it's an honor for me to be here and also to have worked with FEMA in partnership. For me, the Peace Corps and FEMA partnership is a natural partnership because our two agencies share the same values. We both work with local communities, often in conditions of extreme hardship, and we're both very committed to public service. Before I dive into the current partnership, I'd like to share some background on Peace Corps with you. Peace Corps was created 60 years ago with the incredible mission of creating world peace and friendship. And to use a phrase that Hannah just used, it's really a person-to-person interaction. Over 230,000 volunteers have served overseas, the majority in 2-year assignments, working and living in their communities. This often includes exposure to new practices and religious cultures. Integration through both learning the local language and being a part of the community is key to ensuring volunteers have a safe and enriching service. So the next slide, please. I lead the small but very mighty Office of Peace Corps Response, which started in 1996 as Crisis Corps. We're very proudly celebrating our 25th anniversary this year. And it was created to harness the skills, experience, and motivation of returned Peace Corps volunteers to help communities recover from conflicts and natural disasters. Through the years, however, the demand for specialized volunteers in non-disaster situations from our host countries grew. And in 2007, Peace Corps changed the name to Peace Corps Response to allow the program to broaden its scope and meet critical needs in short-term, high-impact assignments. More than 3,000 Peace Corps Response volunteers have served, including 400 that have served in 2 historic partnerships with FEMA, the first during Hurricane Katrina and the second now with the COVID-19 vaccination efforts. Next slide, please. Peace Corps Response volunteers serve in 3 to 12 month assignments. This is different compared to the usual 2-year service for the traditional volunteers. And they bring with them specialized skills specifically requested from the host country partners. And those partners are generally government ministries, universities, and local NGOs. Next slide. Peace Corps has a unique approach to international development, we seek to find alignment between the host country priorities, community priorities, and the volunteers' skills. And through this alignment, our goal is always to create sustainability. So those practices are there even after the volunteer leaves their assignment. Every Peace Corps volunteer receives training on this unique approach, as well as the language of their host country. As I mentioned before, integration through both an understanding of the language and knowing their communities is key to a successful service. Volunteers are encouraged to be an active part of their new communities by finding leaders and listening. There's a lot of listening to the community members' needs. Next slide. Peace Corps' work and mission is focused on serving overseas. So you're probably asking, how is it that the volunteers are now serving here in the United States with FEMA? In March 2020, nearly 7,000 Peace Corps volunteers were evacuated from 60 countries because of COVID-19. This was the first time in history that there had ever been a worldwide evacuation. And today we're working hard with our host countries to guarantee safe returns for volunteers to serve overseas again. Earlier this year, FEMA reached out to Peace Corps because they recognized the potential in these evacuated volunteers to assist with the COVID-19 vaccination distribution efforts in the United States. Not only would these volunteers have critical language skills, but they know how to build trust by listening to people and meeting people where they are. And as has been mentioned, it would be just the second time in history that the agencies work together. And Peace Corps was really driven by the focus on placing volunteers in communities with populations that are traditionally underserved. Next slide, please. In May 2021, 158 Peace Corps response volunteers were sworn into service for 3 months, and these volunteers have served in 7 states. The assignments in the blue states of Illinois, Maryland, and Maine have already finished, but the work continues in those green states of Oregon, Nevada, Virginia, and New Jersey. And the volunteers have taken on a number of different tasks. Whatever is asked of them, they're happy to do. They've assisted in non-administrative roles at the mega vaccination centers, and as that work finished, they have moved into mobile units traveling throughout these states, and a large number of them are conducting outreach door to door and street corner to street corner in underserved communities. In many of these states, the volunteers have been assigned to very difficult missions, trying to reach people at the last mile, those that are the hardest to reach either geographically or because they have had doubts about the vaccine. Next slide, please. The volunteers are a diverse group, as you can see from this slide. They range in age from 22 to 80. Over 50, they're about 50-50 female and male. Over 40% identify as a racial or ethnic minority. 94 of them have stated they really want to return and finish their overseas Peace Corps service. They collectively served in 52 different countries, and they speak 88 different languages. The next slide, please. This diversity and representation has been, I think, the key to their success. One reason FEMA wanted to have volunteers help was because they could use these crucial language skills. And every day we hear wonderful stories about volunteers comforting uneasy or uncertain clients through connecting with people in their own language. My favorite story is about Dustin Gerhardt, who served in Senegal. And as he was checking into the hotel before he started his assignment, he noticed the hotel worker had a Wolof last name and immediately started speaking a Wolof to him. And the man brought his entire family to the vaccination center the next day to get vaccinated. And Dustin also got an incredible restaurant recommendation and learned where the best Senegalese food was. So I think it was a win-win for everyone. Next slide, please. In addition to the language skills, the volunteers are able to use the training they received in building trust and meeting people where they are in the local communities. Peace Corps volunteers are willing to get out and meet new people. I like to say a Peace Corps volunteer has never met a stranger. And they make a point, because they've been trained to, of finding leaders in the communities that they serve in. I think these leaders are both informal and informal roles. So 2 stories come immediately to mind. In Peoria, Illinois, where this picture was taken, the volunteers were having a really hard time getting people to speak with them in the community they've been asked to serve. And they started attending the local community events, and they met a local pastor who immediately embraced them and introduced them to the community. And through this trusted source, they were soon able to start outreach events in the area, working with small business owners and others to get the word out. Another great story is in Oregon. We have an incredible partner with the state Oregon Health Authority, and they have done extensive work with vulnerable populations living in the housing authorities there. These are victims of domestic abuse and the houseless. And just through patience and perseverance and being there and repeatedly showing up, the Peace Corps volunteers have worked to build trust and slowly built relationships. And so, the trusted informal leaders of those communities rolled up their sleeve and got a shot, and everybody else started to quickly line up. Then the next slide. So these response volunteers are in the final weeks of this important assignment. They have been an inspiration to all of us at Peace Corps as we work hard to ensure a safe return to our overseas work. We're also very appreciative of the partnership with FEMA, this would not be possible, as well as all of the state and local leaders who have worked with these volunteers during their service. These partners have described the volunteers as dedicated, skilled, and passionate. And I'm glad that now the U.S. partners have gained more exposure to the capabilities of Peace Corps volunteers through this historic partnership. So if you're interested in more information, you can reach me here at this email address, and we have a lot of really wonderful photos and stories that we're sharing on our social media. Thank you very much.
And thank you so much, Sarah, for what you shared. Truly, I was encouraged by your stories. And to me, one important piece that I'm hearing is about the importance of connecting with people through language and common customs. And the unique experiences that the Peace Corps brings back to the U.S. is that we're able to connect throughout the nation with those skill sets that they've gained internationally, and are helping to connect with people, but even encourage people to get vaccinated. And so again, that story about speaking of Wolof and connecting that family to get vaccinated, to me is just an encouraging story into itself. And I'm sure there are others like it among other Peace Corps volunteers who have served so faithfully in this country and abroad to support others around the vaccination efforts. So again, we thank you for the partnership with the Peace Corps, and so grateful for you sharing with us today. So thank you so much again.
Thank you.
Thank you. And with that, we're going to go ahead and transition to our next presenter, Ms. Corinda L. Washington. Corinda, in May of 2021, joined the Senior Executive Service as the Executive Director for Social Impact and Campaigns in the Office of Partnership Engagement within the Department of Homeland Security. In this role, she leads the coordination of the U.S. Department of Homeland Security's engagement with faith, non-governmental, and community-based organizations. She also oversees the department's Blue Campaign and If You See Something, Say Something public awareness campaign. Prior to this role, Corinda served as the Acting Assistant Secretary for Partnership and Engagement. During her tenure, she led the coordination of the Department of Homeland Security's engagement efforts, ensuring a unified approach to external engagement. In 2021, Corinda led the establishment of the Office of Partnership Engagement Faith Initiatives Division and the Department of Faith-Based Security Advisory Council, while also serving as the Office of Public Engagement's Chief of Staff. Before joining DHS, Corinda served 10 years in the private sector in Detroit, Michigan, which is her hometown, where she continues to serve and lend her expertise within her community. With that, excited to extend time now to hear from Corinda and the good work that she's done in Detroit, Michigan, in the vaccination efforts. Corinda, we're so glad to have you today.
Thank you so much, Nicole, for that kind introduction. And thank you to Melissa Rogers and the entire White House team, Brandy, and my fellow panelists. It's just an honor to join you today. it's a special conversation to talk about home, to talk about Detroit specifically, and the vaccination center, mass vaccination center established there at Ford Field. And when I got the call from Kevin Sly, the FEMA Region 5 acting regional administrator, I thought, there's no way I could say no. This is home. And at that time, I hadn't traveled officially for work since before the pandemic. But I thought, what better time for me to lend my voice, to lend my influence, to hear from community members there on the ground on what was needed in the city of Detroit. So with that, we'll get started. Next slide, please. The ask, the answer, and the challenge in Detroit. Next slide. And next slide, please. The ask was for community members to join us in Detroit to assist with the mass vaccination center location at Ford Field. The answer from community members was absolutely. We'll support. Next slide. And we'll ensure that we're able to get to the community. But the challenge was Ford Field. So for those of you who may not understand what the dynamics are, Ford Field is downtown Detroit. And when we talk about neighborhoods and community access, that alone, that facility alone became problematic. And community members began to share and ask questions about why not the neighborhood? Why not a local house of worship? Why not my church? Why not my community center? And so we had to talk through options, mobile vaccination clinics that could go out into neighborhoods, as well as how we could facilitate providing resources to those community members who are raising their hands saying, I'll help. But these are some of the ways in which I could do this better. Next slide, please. So when we talk about COVID-19 vaccine equity in Detroit, it's a different dynamic. And that dynamic was resonated throughout Region 5. We started in the city of Detroit, but went to other communities that were saying the same thing. And the question was, how can we make sure that individuals can stay within their neighborhood to get the vaccine through trusted partners versus having to go to mass vaccination locations? So there were pros and cons to both, right? We knew that individuals who were receptive to the vaccine, who wanted the vaccine immediately, would go to Ford Field. And we knew also that TCF, which was another mass vaccination center that the city of Detroit had stood up, was only a few miles away from each other. And so that one was being successful as well. But the question was still coming from the community, why not local first? Next slide, please. And so we held 2 days. The first day was with community leaders, with our lieutenant governor for the state of Michigan, as well as congressional members to really hear what they were hearing from their constituents in regards to the Ford Field location and the accessibility, and what we were hearing from underrepresented and underserved residents through those leaders. So we did it in twofold. We had our most senior leaders in the community, as well as local community leaders on the second day. And one of the things we heard was location, location, location. In Detroit, there is a versus everybody movement. And that resonated with the community members. TCF versus Ford Field. A local barbershop on 7 Mile versus Ford Field. What were the pros and cons of having the locations for the vaccine and promoting accessibility? The other thing we heard, and we'll go to the next slide, was the trust factor. Do I trust the source of this information? Do I trust the individuals who are actually going to put the shot in my arm? Do I trust that entire process enough to leave my local community, to leave my neighborhood, and go downtown? And so we saw the feedback from the community that said we could do both. Again, making sure that we had access through the mass vaccination process. Mobile vaccination units were also at play. And then we had the neighborhood. The overarching response was neighborhood first. But there were pros and cons with that as well. Next slide, please. Community and neighborhood first meant that there would have to be some intentional funding involved. During this roundtable of this picture there on the screen, where we're hosting this conversation with local clergy, also local nonprofit and NGO leaders, as well as private sector that participated, community center operators that were saying, what about youth? What about youth engagement and youth access? What we heard was, especially from the clergy members, this was back in March, that their doors hadn't been open for their congregations, let alone the community. And so therefore asking to utilize their locations, would there be any funding attached to it? Next slide, please. So intentional funding is needed. And I really liked what Dr. Vick said, intentional. That word resonated with me because also we heard it from the community that said, if you really want us to help, we can only do so much for free. Giving is down. Our church doors have not been open. Our houses of worship have not been open. Giving is down. Our community center has received some donations, but some funders have fallen off during the pandemic. And so that became a challenge as well as how community members could access some of the funding that had been made available for the COVID-19 vaccine response and distribution. And so from that, next slide, we were able to host a follow-up conversation webinar to provide information for community members and community organizations to request funding from FEMA in order to deploy the vaccine in their local community. And that was a huge accomplishment because it took coordination at the state level, at the city of Detroit level, as well as federal resources to coordinate to find a way forward to provide that intentional funding. That was one of the biggest takeaways for me in recognizing what was the challenge, boots on the ground, when we really operationalized this effort. What were the challenges? And a lot of it came down to funding and access. Most of these locations in the neighborhoods were being run by volunteers, and they were not properly funded in regards to any financial assistance that was coming in for utilities or, opening the doors to have the water running for folks to even use the restrooms, right? Like what type of access and support could we provide for these community organizations? Takeaways from that. Next slide. We all have heard it. We all know it. We heard it loud and clear in the city of Detroit that representation matters. Representation mattered from the time the individual was greeted coming through the door at Ford Field, which FEMA did, and DHS and all of our partners, DOD, did such an amazing job to make sure that even the experience walking in, individuals felt welcome. They felt comforted and greeted. And there were individuals there that looked like them. There were individuals there, as my colleague said from the Peace Corps, that could speak their language, right? Those things matter when I am making a decision on whether or not I want to receive the vaccine. So we knew that. Next slide, please. We also knew that representation mattered to even have the seat at the table. for the community leaders and for the community organizations to be escorted to the table. That meant that they had the support system. We had developed a network within FEMA and within Homeland Security to provide that access. By doing that, I'm still getting phone calls from clergy and community members in the city of Detroit because it started with a conversation on the vaccine. And then it opened the door for more conversations. How can my youth get access to internships at Homeland Security? How can we have opportunities to even be educated on what Homeland Security does, what FEMA does? It opened up even more opportunities by just giving them a seat at the table and escorting them into that process. So representation definitely matters. We also want to talk about the power of being a spokesperson. Each of you, I want to thank you for being on here to participate in this webinar. Next slide, please. Each of us have the opportunity to let our voices be heard. And don't be shy about it. Let us know. Let us hear from you. We want to hear from you. That's why we're here. In order to give that local grassroots perspective at the national level and vice versa, we need to hear from you. And so I am so honored to have this opportunity to share what took place in Detroit. And again, one of the biggest takeaways was making sure that it was community and neighborhood first, as well as intentional funding in order to assist you in doing your jobs better. Thank you for all that you do. I'm going to transition now and to give you just a little bit of insight in regards to the new office. Next slide, that I am standing up here at the Department of Homeland Security. Social impact and campaigns. A couple of these things were pre-existing programs that are now coming under my portfolio. But for the first time, an executive director of social impact is in existence at the Department of Homeland Security, and I am honored to be selected as the first. And I do declare today that I will not be the last. The Office of Social Impact and Campaigns will foster community engagement across the entire DHS enterprise, the Homeland Security enterprise, ensuring that underrepresented, underserved communities have access to the department and all of our resources, while also continuing all the great work that we do anyway. The Department of Homeland Security has over 240,000 employees that are located all over the world, doing amazing work in local communities, but it was not coordinated in a way that will give our secretary, deputy secretary, and other DHS senior leadership information on all of the resources that we're providing, and then to get that information back from local communities. So within social impact, I also have faith engagement, NGO and nonprofit engagement, as well as our campaigns. If you see something, say something, and Blue campaign. Next slide. So Faith Initiatives is a part of and in partnership with the DHS Center for Faith-Based and Neighborhood Partnerships, and of course the office at the White House as well. And it is established within DHS headquarters within the Office of the Secretary to, again, elevate your access to the department's leadership, as well as to hear in real time as best we can what challenges you have from the safety and security side of the house, as well as the community volunteer side. So we are so thankful to have this new division within Homeland Security headquarters, and it will be supported by soon the Faith-Based Security Advisory Council, which will be a body of individuals who would advise the secretary on issues that are relevant to the faith community across the entire Homeland Security enterprise. Next slide, please. And again, and we can go to the next slide, we are working with the DHS Center, and then the other huge aspect that we're working on from a community perspective is our police reform agenda and our use of force agenda for training our law enforcement, as well as sharing that information with state and local law enforcement throughout the country. So there will be more to come on that effort from the Department of Homeland Security. Next slide. Am I still there? Did I freeze? Next slide, please. Thank you. The two campaigns that I oversee, one is our Blue campaign, which is our human trafficking awareness campaign. I hope you've heard of it. We are working every single day to ensure that we can end this heinous crime. And so we want you to make sure that you check out the Blue Campaign's website. There are materials available for your organizations that you can utilize and toolkits for you to be able to promote not only for your local organizations, but just your community in general. Next slide. If You See Something, Say Something is the other campaign, and I hope you've heard of it. We are proud to announce that we have added additional translation materials are available in several languages now, including Arabic and Chinese. And so we are just so excited about the expansion of the resources that have been made available under the new administration, and we will continue to expand our work. We look forward to partnering with your organization for both campaigns, both Blue Campaign and If You See Something, Say Something, partners with local community organizations each day. And so I look forward to the opportunity to partner with you. Next slide. Here's my contact information. I'll be around for the Q&A session. And again, thank you for all you do in the community each day. And thank you, Nicole and Brandy, for this opportunity today. And I'll turn it back over to Nicole.
Thank you so much. I truly appreciate you, Corinda. And you said to me something that was so important, and that is representation does matter. And you representing us at DHS, but also at the local level. And what I think you did that was so unique is that you were able to uplift, and because you had built trust and you were able to help build access, and equally you were able to help ensure that we make faith and community-based organizations first. And so again, we're grateful for your leadership. We're grateful for what you did and impacting the city of Detroit, but not just the city of Detroit. We know that you're doing the same throughout our nation in this role that you're in now. So again, thank you for your presentation. Thank you for the good work you're doing, and so grateful to work alongside you. Thank you so much.
Thank you, Nicole.
Thank you. With that, we're going to go and transition to our next presenter. Our next presenter is Dr. Golda Downer. She's the associate professor in the College of Medicine at Howard University. Currently, she heads the Howard University's Telehealth Training Center, which is tasked with developing and managing a national e-learning technology training program. During the past decade, Dr. Downer has expanded her portfolio to include emergency preparedness and disaster management. She has served as an instructor for FEMA's Emergency Management Institute, and she also conducted joint venture activities with Boston University's Healthcare Emergency Management Program. This includes what she's developed and conducted a hybrid of exercises for the Uniformed Health Service Medical School. Dr. Downer has served as a subject matter expert in food security and food aid and emergency disaster relief for the United States Agency for International Development. She has also lectured internationally on the importance of cultural competency in emergency and disaster response, as well as on the intersectionality of HIV and disaster management. She's a co-founder of the Historically Black Colleges and Universities Emergency Management Workforce Consortium. She's also a national community emergency response team trainer and manager. She is an author and previously served with the Department of Pediatrics at Georgetown University Medical School and the School of Public Health and Health Services at George Washington University. We are certainly grateful and pleased to welcome Dr. Golda Downer. Thank you so much for joining us today, Dr. Downer.
Thank you so much, Nicole. Thank you for having me. I don't see my screen. Can you hear me? Thank you so much, Nicole, for having me. I want to begin by just saying on behalf of the HBCU Emergency Management Workforce Consortium, thank you, a very big thank you to you all. I will begin with a brief history, though, of our HBCUs and their vital role in our community. Next slide, please. In 1862, Congress passed the Maury Land Grant Act, giving federal land to states to support at least one college where agriculture and the mechanic arts were taught. All but one of these institutions that benefited from the government's investment were white. Noting the disparity in 1890, the Morrill Land Grant Act mandated that states open their land grant institutions to Black students or allocate monies to them. In 1900, nearly 4,500 Black students were enrolled at HBCUs. Now, a little known fact is that our HBCU students include white students of low socioeconomic status, as well as our Native Americans and other ethnic minorities. And true to its mission, a full quarter of our HBCUs have at least 20% non-Black students as their body. Bluefield University in Virginia, for example, has a 90% of their student body is white. Now, as you continue to look at this slide, you'll notice the Higher Education Act of 1965, which was amended. And as amended, it means that the numbers of HBCUs can never increase. HBCUs account for about 3% of America's colleges and universities, and they really are vital to our community because this 3% of American colleges and universities graduate about 20% of all African Americans, about 25% of graduates of STEM, 40% of our current members of Congress, 42% of engineers, and 80% of all our judges are sons and daughters of an HBCU. Next slide, please. You will notice where our HBCUs are located based on our FEMA regions. The highest number of HBCUs, 60% actually, is in the southern states. Now, you'll notice that that's where the burden of COVID also is. We have no HBCUs in FEMA region 1, 8, and 10. Next slide, please. I'm going to go on again briefly to talk about the HBCU Emergency Management Workforce Consortium. We know that African Americans are woefully underrepresented in the emergency management field. And about 3 years ago, a partnership with academia, public and private, we established this consortium. We've done some research and also recognize that the educational pipeline does not show greater representation in the future for the emergency management workforce. So our mission is very simple: to educate the pipeline and strengthen that pipeline for African Americans, and to do so in a culturally competent manner, with collaboration, of course, from more enduring partners. We're using CERT as the stepping stone for this mission. We posit that we are not able to sprinkle our resources since we cannot impact change that way, but focus our work to get to the targeted community, which are our HBCUs. And by the way, there are 102 HBCUs to date. You know, when a disaster strikes, emergency managers are often the first organized groups that come on the scene. They do incredible work. But sometimes it's during this period that victims of a disaster find themselves further marginalized, whether inadvertently or deliberately, by those who are sent to help. So the ability to work effectively across cultures in a way that acknowledges and respects the culture of the person or the community or organization being served is also a focus of the HBCU Workforce Consortium. The next slide, please. So we have very, very focused, deliberate attention to what we plan to do. Educate and train, and we want at least 10% of our HBCUs by the year 2025. We want to obtain funding to have CERT in our HBCUs, to establish centers of excellence, and also to promote a culturally competent curriculum for our students. Moving on to the next slide, please. So now we're going to the meat of the matter, the COVID Awareness and Resilience Day. The goal of this HBCU COVID Awareness and Resilience Day is really to bring awareness to our HBCU campuses and surrounding institutions that are anchored within the community. Last year, with the help from the White House Initiative and HBCUs, we sent out a questionnaire to our HBCU leadership to query them as to whether or not they'd be able to continue to open their universities in a safe manner in the fall. We have about 24 programs at different HBCUs nationwide, and our faculty decided from our partners that we would also query the students. And these students shared with us that they didn't have the bandwidth to download their work. They didn't have the laptops or desktop computers. They actually asked us for ear muffins and earplugs so that because the environment was too noisy. Some shared with us that they didn't have a desk or a table and they would use ironing board to do their work. So we think these are phenomenal, indomitable spirits that these young people have. And so we wanted to include them and ask them, how can we help you to safeguard yourself against COVID as well, understanding that there were many challenges. And that is why we focused on our HBCUs. The historical foundation of the HBCU academic community and the high degree of trust it has earned among African Americans nationwide make this a unique group, and they are natural champions in this fight. We were deliberate also in choosing who would work with us, and so we had focal points who are familiar with the culture of our community. We had focal points for each of the 7 FEMA regions where our HBCUs are located. We had Dr. Sion Smith, Dr. Kevin Kupiet, Dr. Noel Estwick, Dr. Keith Powell, and former, I should say, retired Congresswoman, Dr. Donna Christensen, who were the focal points for each of the regions. We also were joined by our national co-chair, Mr. Marcus Coleman, who made sure that our work was amplified and what we were doing, the students were made aware of it. Next slide, please. Here are the partners who worked with us as we created the HBCU COVID Awareness Day. They were actual joint partners, and each of these individuals, and they're growing, have worked with us to make sure that our work was amplified and that the students were fully supported in all their work. Next slide, please. The U.S. Health and Human Services COVID Community Core and Made to Safe campaigns also partnered with us. As we all know, both are national campaigns that focus on empowering people to talk with family and loved ones about protecting themselves from COVID. As you look at this slide, what we know is that our HBCU students, we identified leaders on the HBCU campuses, and we had 41 HBCUs to participate in this COVID Awareness and Resilience Day. We chose the students because we know that HBCU student leaders are armed with the language that resonates with their peers. We also know that theirs are the trusted voices that can crowd out the false narratives. And quite frankly, we need to be truth tellers ourselves and stop talking about miscommunication, misinformation, false narratives, and just call it what it is. They are lies. Our students are confused because when we speak to them, they share with us that when they hear miscommunication, they feel that part of it is true and part is not. Well, let's just be clear and tell them these are lies. These are student-led, student-driven initiatives, and they also included our international students. Next slide, please. The students were the ones who developed and came up with the activities for the community. And you can see the list here. And are those 2 students not resilient? They certainly are. They also came up with a list, next slide, please, for the campuses. And one of the things that was really riveting for us was how the students worked collaboratively across institutions. Many of the students, for example, had community day or town hall meetings, and they asked for the students from our HBCU, College of Medicine or Pharmacy or Nursing, to actually support them and be the leaders to have the discussions. And that's what we were looking for, trusted voices that are giving accurate information. Next slide, please. I'm going to show you a little bit of the data that we've collected so far. So these are the type of activities, educational activities that were done. And the bulk of it, of course, was done on the campuses, as you can see. But you can also notice that we had activities in the community and town hall meetings that were in churches and other places. For the Q&A, the students went to, for example, barber centers, hairdressers, the grocery stores, the corner shops. So they were there and were ready to answer questions as they arose. The next slide, please. In terms of our social media activities, again, communication was important, but we had many of our students who did quite a bit of short videos and PSAs. We thought they enjoyed doing this. And remember now, all of this is done without any funding. They did all for themselves, but it resonated with their peers and with the other students across the country. The next slide, please. This was a very pleasant and exciting slide for us because what the students did, this was so important to them. And remember now, this was in May when the students were not yet fully given the vaccinations, but they encouraged the community to actually take the vaccination. And for those HBCUs that had a vaccination site on their campus, they encouraged staff and faculty to get vaccinated. And they too who were able to were vaccinated. So we were very excited to see that this was something that all of the students participated in. I should say by about almost 90% participated in, and this was impactful. The next slide, please. This slide looked at behavior modification, and wearing a mask was something we discussed at length. Wearing a mask did not mean wearing it on your forehead or under your chin, but to wear it correctly and consistently at all times. We use the CDC data to actually educate our students so they felt comfortable when they went out in the community to provide the information they needed. The next slide. In terms of engagement strategies, you will notice that the community partnership was significant, and alum for our HBCUs were just phenomenal. There is a groundswell of support that this can be done. The key thing I wanted to leave with us today is that our students, they are the leaders, and they know what to say and how to say it. I want to really thank Dr. Susan Randolph of the MyTech Corporation, who was able to analyze the data for us and let us have it available today. And Dr. Justin Morales, our Howard University Med student president, who just matriculated, who came up with the hashtag HBCU against COVID. The last slide, please. I should say the next one. Here are some of the activities that were done in the community that we supported. We supported Southern University with their statewide virtual panel discussion about COVID. We also were excited to know that Allen College, Allen University, you can see exactly what they did. Not just one event, but several. And Tuskegee did an entire week of COVID awareness. We thought that was brilliant. One of our partners, the National Minority Quality Forum, also worked to have an event, Facts, Faith, and Fears, here locally in Baltimore. The information on the screen is information how to get a hold of us and to participate if you'd like, which is the last slide, please. Let me just say this. Our community is burning. And as a community, we must collectively decide if we will be firefighters or are comfortable watching the flames. I have every confidence that together we can put this fire out. Thank you.
Thank you so much, Dr. Donna. We truly appreciate all that you've shared, and in particular, the dynamic work of the HBCUs across our country. The tireless work of our students, the tireless work of the faculty within these HBCUs, but even importantly, how the HBCU Emergency Management Workforce Consortium collectively works with federal, not just HBCUs, but with the federal agencies and private and public groups, because they know that that's that collective effort that we are able to accomplish more. Equally encourage how we are using students as ambassadors and using them to connect and having that peer-to-peer outreach and connection. So again, I'm just encouraged by the good work that you're doing and that you're leading and the effort that you're doing and moving forward. And I do believe we have a quick video.
Yes,
we have for that. Excellent.
To my Viking family, I am Jimmy Chambers, the student body president here at Elizabeth City State University. I have already received my COVID vaccine, and I encourage you to do the same. So you can do so by setting up an appointment here on campus. Together we can prevent the spread of COVID-19. Viking pride.
One of our simple and effective way of meeting students.
Excellent, excellent, excellent. Thank you so much for that, and thank you so much for sharing that. Now I will have a time to invite everyone back in the spirit of time. We're going to just jump right into our questions. And I'm actually going to open this up to all of our presenters, because this is something I've been hearing. We want to first thank all those who sent their questions in advance. We certainly had well over hundreds of questions, but we did see some common themes, and we know that some of you have been writing in as today. One of which we want to uplift that I'm hearing, some had actually directed to you, Dr. Downer, but also there were others who had for Dr. I'm sure others, even Sarah or even Corinda, would like to address. With the increase of the Delta variant, There is concerns of how, as either federal agencies and even HBCUs are moving forward with this. Are there new strategies that we're taking? Are there things that we're doing differently? And we certainly want to hear, a lot of those questions have been that common theme of how are we responding collectively in partnership around the Delta variant as we're moving forward, and knowing that we are still in this pandemic. We are still responding actively, and certainly welcome anyone who would like to respond to that question.
I think I'd leave that to the White House. I know that at Howard University, we have a hospital on campus, and I can't speak for all the HBCUs, but the Delta variant is now, I mean, it's such an important piece, and a piece that we have to pay attention to. And if we're having congregate meetings, as with our students, that's something for us to think about. So we're strategizing as we think about this now, because students have begun back on campus. And so that's something that we have to now pay attention to. I think wearing a mask consistently after being vaccinated continues to be what we will follow, the tenets of the CDC.
Excellent, excellent. Are there others within government that just wanted to chime in with that? I don't know if Hannah or Sarah wanted to comment to that.
I could jump in here. I think that number one, there's been a ton of lessons, like we've all talked about, in terms of engaging the community and getting as close as humanly possible as we can with the individuals that are most affected. So in that line, I know with the Delta variant, working very closely with the White House, the CDC, and HHS to make sure that federal support continues to be available, and that can look a lot of different ways. I know at FEMA, one of the things that we're really promoting right now is we have what we call our public assistance program, which is one of the main funding streams for state, local, tribes, territories. And one of the things that we do fund is outreach activities. Now that funding has to go through the jurisdiction, but we are encouraging, we're doing webinars, we're doing everything that we can to encourage those jurisdictions to take that money and to promote out in a very local way, a hyper local way, what it is that needs to be heard in these particular communities.
Excellent. Thank you so much. Another quick question. This could go to Corinda. I'll go ahead and ask you this. How has the whole community approach benefited marginalized communities like Detroit and Chicago in the wake of COVID-19?
I think the FEMA response efforts in Detroit are a great example, because it was very local, with the city of Detroit and Mayor Duggan taking lead initially in some of the deployments in the community locations, as well as the state, private sector. You know, you had TCF and Ford Field. Those stadiums were sitting empty because of the pandemic, and opening it up. And Meyer. And so that public-private, I like to call it P soup, public-private, all of it in private, all of those P's have to come together in order to fully realize the whole of community approach. And so I think that it continues to be true, even still today, of hearing that the door-to-door is still happening, that community locations are still, pop-up sites are still happening as the need continues to show and deem helpful in the city of Detroit and other cities around the country like Detroit.
Excellent. Thank you so much. And Sarah, if we could just kick us off with this, and certainly Hannah can chime in. Folks are really excited about to see this FEMA Peace Corps connection. Are there opportunities for other engagements, or you are at least even discussion? Certainly what you can share, I think, welcome, but there are a lot of folks that are excited about the partnership and what has taken place and just how we're moving forward as two federal agencies and how you're partnering together.
Sure. So as mentioned, this is just the second time in Peace Corps history, FEMA's history, that we've done this partnership. And Hannah mentioned they're getting back focused on fighting wildfires and hurricane. And of course, at Peace Corps, we're working every day on trying to get the volunteers back to their overseas service. So the assignment is 3 months, and it's going to end, in about 3 weeks. These volunteers that are out there, they're putting their pedal to the ground, and they're not letting up. I think it's a conversation to be continued about what makes sense. At Peace Corps, we're really being challenged to meet the moment. And our moment still is, what can we do to help our our partners overseas, because they're also devastated, in particular by the Delta variant. But we couldn't leave the opportunity to contribute to the FEMA effort on the table. And so we were really proud and really honored to be a part of it. And we see that as like the first step into helping with the global COVID response effort.
Excellent, thank you. And Hannah, I'm going to ask you this. There's a lot of interest around the mobile units, a lot of individuals who want to have those mobile units in their communities. I think Corinda made the point. Folks would welcome you to come into their community, in large part because of access. It's not necessarily hesitancy sometimes. It's really about access. And that sometimes it's how to get the resources into communities who need it most. So if you could speak to the work that FEMA and other federal partners are doing around mobile units, that would be welcome to hear more about that.
Absolutely. And I think that during this entire mission, I think there was so many, wonderful examples. I think we all have them about innovation and, people stepping up. And I know with the mobile unit concept, we certainly saw that all across the country. And so FEMA has a particular mobile unit. We've got a couple of dozen of those. But more importantly, we had local and states who stepped up with all different types of mobile units that they deployed out. And in some cases, these were like vans, right, with a couple of folks in them, and they would like pop out and they would go from like center to center. And then others, had a full vaccination, capability. I know the Veterans Administration, I think they had like big buses, right? So there were all different types of these types of units. A big success that we did see with our mass vaccination centers was what we called the hub and spoke model. And we were able to deploy that, I know, out in California and in Florida, a couple of other states. And what that did is we had like a central, larger location. And then with the spokes, we were able to, in a mobile kind of way, provide that access with making sure that the management of, the vaccine access, the outreach strategy was all coordinated. So if there are communities or organizations that are interested in pursuing a mobile vaccination unit, the best course of action is to reach out to your state emergency management agency. The state emergency management agency works with FEMA directly, and they're in constant contact, talking about the resources that they need. So getting those types of requests up would be wonderful. We still have many units that are out and about.
Excellent. And as we close our time, I just welcome to hear from all presenters as we're moving forward and with this theme of partnership. And what are some unique things that for us to consider as we're moving forward? I think there's a lot of lessons learned, I'm sure, from all of your experiences. But what are some things that we can have important takeaways, action items for all of the attendees who are here and who will receive this recording? What are some important lessons and things to think as we're moving forward, thinking about partnership, thinking about how we can best engage around this vaccine distribution? So I feel led to kick us off, but feel free to jump in.
My biggest message to you today is don't self-select yourself out of the process. We want to hear from you. We want to partner with you. If you've not traditionally partnered with us, you're the exact candidate that we want to hear from. DHS is open. Our entire components are. The government is. We're open for business and partnership. And so want to make sure that you walk away with that message. Contact us. Utilize those email addresses. We work for you. And so please allow us to partner with you. Thank you.
Excellent. Other speakers?
I'd say that make sure, I think as Corinda just said, make sure that we go out and speak to the people that we normally don't speak with. This is so important. I mean, it's easy for us to talk to our friends and talk to our colleagues. We just shared about an entire community, the HBCU community, not just the universities, but the anchor community in which the universities are sitting. And use the people, don't just say the trusted voices. Really, really put the money where the mouth is. For all the work we've done and I've reported on today, there was no funding associated with it. It's all voluntary. Now think of what has been done with no money. Think what could be done if some money was leveraged to this community. That's where I think put our money where our mouth is.
Excellent. Thank you. Sarah or Hannah?
Yeah. I was sitting enthralled listening to Corinda's presentation because it is like a playbook out of what a Peace Corps volunteer is trained to do, go into the community and understand their needs and their wants, because they know best. And so really just going in and actively listening and helping understand what the community members are telling you, and then roll all of that in, build that trust, and then understand the best messenger.
And Hannah, you had the last word.
Sorry about that. No, to Dr. Downer's point, I think that such a wonderful and just straightforward message. I think that one of the challenges I think that anyone in FEMA or the federal government faces is making sure that we have a strong understanding and that we're open. We're very, very open to what's actually going on rather than what it is that we think is going on. There's a wonderful researcher in Florida, and she talks to people who are in mobile home parks about what it is that they do before, during, and after a disaster. And what she finds again and again is those people do not describe themselves as vulnerable. They describe themselves as resilient and capable and adaptable. And I think that we need to recognize that there is all of this this capacity, and our role again and again is to support, to lift up, and to listen.
Well, that's an excellent point to close out, and certainly I'm grateful for all those who stuck in as we press forward during this Q&A portion. Be encouraged that this has been recorded. We will also share resources on how you can get vaccinated. Of course, we will share about vaccine.gov, so you can locate where within your community you can get vaccinated. We'll share also information about our funeral assistance program and also our recent HHS grant that encourages partnerships that with public health institutions that you can do on the community level. So we do have some resources that we will be sharing with you along with the recording of this webinar. So again, we want to thank all of our presenters, all of our partners who joined us today. We're grateful, as mentioned, for the White House, Melissa Rogers for joining us, grateful to Dr. Hannah Vick, to Sarah Teach, to Corinda Washington, and to Dr. Olga Downer, and also to Brandy Richard Thompson. Collectively, we were glad to partner together to make this possible, and certainly grateful to all you who joined us, participated, asked those questions, and know that we will continue to be in communication with you moving forward. So again, thank you everyone for your time, your energy, and also for taking time to listen to us as we shared with you. Take care, everyone. Be safe, and we look forward to being in touch. Have a great day, everyone.